Hello everyone. Today we'll discuss about one of the neonatal problem called neonatal temperature control, and also we'll discuss about cause and the treatment of hypothermia and hyperthermia in neonates. Newborn babies are homothermic, but their ability to stay warm might be easily overwhelmed by extremes of environmental temperature. Neonatal hypothermia, often due to lack of attention, continues to be a very important cause of neonatal death. After birth, the skin and the core temperature of the baby falls by 0.1 and 0.3 degrees Celsius per minute respectively. This is equivalent to heat loss of around 200 kilocalories per kg per minute. A newborn is more prone to develop hypothermia because of a large surface area per unit of body weight, and a low birth weight baby has a decreased thermal insulation due to less subcutaneous fat and a reduced amount of brawn fat. In general, newborns need warmer temperature than adults. In fact, a naked newborn exposed to a room temperature of 23 degrees Celsius suffers the same heat loss as an adult that are exposed to 0 degrees Celsius. When we see the mechanism of heat loss in newborns, the first and the most common one is evaporation. This is a major source of heat loss in newborn immediately after birth and while giving birth. The baby loses as much heat when water is evaporated from his skin, the same as evaporation from boiling water. Large surface area, high wind velocity, and the thinner stratum corneum contribute to this type of heat loss. The other mechanism of heat loss is conduction. If the newborn is in contact with a solid object with a lower temperature, heat flows between the two. Heat flow is proportional to the temperature difference between the baby and the solid object that the baby comes in contact with. The third one is radiation. It's a transfer of heat between objects of higher temperature to the next solid object of lower temperature, which is opaque to electromagnetic photons involved. It is a heat loss to the environment, and radiation can be prevented by heat shield or using overhead heater from a warm wall or floor or window surrounding the baby. The fourth one is heat lost from the skin to the moving air. This is called convection. It depends on the temperature difference between the baby and the air. The cooler the air and the stronger the wind velocity, the greater the convective loss from the baby's skin. When we see the mechanism of heat production in the newborn, the first one is muscular activity. During cold exposure, the baby is uncomfortable, and then the baby makes some movement of the limbs, but this movement of the limbs is not sustained. Shivering does occur, but it is minimal, and it occurs when environmental temperature falls below 25 degrees Celsius. So, muscular activity is not a good source of heat production in a newborn. The second one is metabolic thermogenesis. Brawn fat is located around the adrenal glands, kidneys, nape of neck, interscapular area, and axillary region, and deposited mostly in the third trimester of pregnancy. Blood flowing through the brawn fat becomes warm, and through circulation it transfers heat to other parts of the body. Its metabolism results in heat production. So, since this is deposited mostly in the third trimester, preterm babies are at risk of having lower amount of brawn fat, and they are more at risk for heat production by metabolic thermogenesis. The quantity of brawn fat is proportional to birth weight. In term babies, it accounts for 4% of total body fat. And the brawn fat is characterized by rounded nucleus, granular cytoplasm with a large number of mitochondria and fat vacuoles. This fat is metabolically very active in view of a large number of mitochondria and increased blood flow. The third one is central thermogenesis. When the skin is cold, afferent nerves send signal to the anterior preoptic hypothalamic nucleus located near the roof of the third ventricle, and this message will be carried by the efferent pathway down to activate brawn fat stores. And also noradrenaline is locally produced, and it induces oxidation of triglycerides to fatty acids and glycerol. The blood levels of glycerol rises, but fat acids are consumed for heat production. And 30% of non-esterified fat acids are used for heat production, 60% are re-esterified, and 10% are released into the circulation. Effective central thermogenesis demands integrity of the central nervous system pathway, adequacy of bone fat, and availability of glucose and oxygen, normal birth weight, and the term gestation age. So it depends on those things. When we choose optimal thermal environment, thermoneutral environment is defined as a narrow range of temperature at which the baby can maintain normal body temperature with minimal fuel. This is the ideal temperature at which the baby should be nursed for optimal growth. The baby feeds and sleeps well and is comfortable with this degree of warmth. The temperature range during which the basal metabolic rate of babies at a minimum, oxygen utilization is least, and the baby thrives well is known as thermoneutral range of temperature or neutral thermal environment. This temperature is not it's not similar for all newborns because it varies depending on the gestational age of the newborn. A fall in 2 degrees Celsius below the neutral range can trigger the infant metabolic machinery to generate 25% additional heat. Normally, auxiliary temperature is 36.5 to 37.5 for newborns, and we say hypothermia if the temperature is below 36.5 degrees centigrade. And we say mild hypothermia or cold stress if temperature is between 36 to 36.4. We say moderate hypothermia if it is between 32 to 35.9, and the severe hypothermia in newborn is defined as temperature less than 32 degrees Celsius. The warm and the pink feet of the baby indicate that the baby is in the thermal comfort, but when feet are cold and the trunk is warm, it indicates the baby is in the cold stress. And if hypothermia, in hypothermia, both feet and the trunk are cold too much. This is how we can assess the degree of temperature by physical examination alone without measuring by a thermometer. The concept of worm chain. Worm chain is a way of handling newborn, starting from delivery to discharge. The concept of worm chain involves worm delivery room, worm resuscitation, immediate drying, skin-to-skin contact between baby and the mother, breastfeeding, bathing and the weighing should be postponed, appropriate clothing and the bedding, mother and the baby together, worm transportation, training and awareness of healthy care providers are the components of the worm chain. To see the prevention of hypothermia, we should have to conduct a delivery in a warm room. Immediately, we should have to dry newborn with a clean, soft, preferable warm towel. And also, we should have to use another warm towel to wrap the baby in 2 layers. That means we should not use a towel that we used to clean the baby for wrapping the baby. We should have to also ensure head is well covered and keep the baby by the side of the mother. Mother's temperature will keep the baby warm. And the bathing of the baby at birth is a dangerous practice and it should be avoided. Most of the time, bathing should be delayed for inter babies. It should be done after 48 hours, and in preterm babies it might require longer. Skin to skin contact or the kangaroo method. This assists in maintaining the temperature of the infant and it facilitates breastfeeding, and also it helps to increase the duration of breastfeeding. This improves also mother to infant bonding. The other is temperature maintenance during transport. If we are going to transport a newborn to other healthy facilities, we should have to maintain a warm chain. So what we should have to do is we should have to maintain a thermoneutral environment during transportation. Always stabilize the baby temperature before transport. So before starting transporting the baby, we should have to make sure that the baby's temperature is stable. We should have to record temperature before transport and take remedial measures. And if temperature cannot be documented, we can use touch to judge the temperature. Hands and the feet could be as warm as abdomen. And carry the baby close to the chest of the mother during transportation. Cover head, legs, and hands and avoid undressing the infant for cleaning. Weight or examination should be postponed until baby is warm. Thermocool box with pre-warmed line or plastic bubble sheet or silver swaddle may be used during transport. Water-filled mattress with a thermostat to control temperature may be used for transport if available. To see the signs and symptoms of hypothermia, it has hypothermia have multiple effects on the body's organ system. When we see the peripheral vasoconstrictive effect of the hypothermia, it causes acrocyanosis, cold extremities, and decreased the peripheral perfusion. And also hypothermia have CNS depression effect, and it causes lethargy, bradycardia, apnea, and the poor feeding. It also increases metabolism. So hypoglycemia, hypoxia, and metabolic acidosis are the metabolic effect of the hypothermia. And also it increases pulmonary arterial pressure, and it causes distress and tachypnea. It causes increased pulmonary arterial pressure. Chronic hypothermia causes weight loss and poor weight gain. When we see the management of hypothermia, if it is mild hypothermia, skin-to-skin contact is important, and also warm room or warm bed is important, and radiating heater or incubator is to warm the baby is also needed. And infection should be suspected if hypothermia persists despite above measures. If we make skin-to-skin contact, and if we warm the room of the baby or the bed, and also if we use radiant heater or incubator, but the baby remains hypothermic, we should have to think of infection as the cause of hypothermia. And monitor auxiliary temperature every half hour till it reaches 36.5, and then hourly for the next 4 hours, then 2 hourly for 12 hours till discharge. Moderate hypothermia, that means 32 to 36 degrees Celsius. Skin-to-skin contact should be in a warm room and warm bed. We can also use warmer and incubator if available. Continue rewarming till temperature reach normal range, and we should have to monitor the temperature of the baby every 50 to 30 minutes. And the management of severe hypothermia is it needs air heated incubator or manually operated radiant warmer or thermostatically controlled heat mattress, which is set at 37 to 38 degrees Celsius. Once baby temperature reaches 34 degrees Celsius, the rewarming process should be slowed down. We should have to monitor blood pressure, heart rate, temperature, and the glucose if facilities are available. So it is important to monitor the temperature of the baby closely. Till the baby's temperature reaches 34 degrees Celsius, we can rewarm it, and after that we should not rewarm the baby more than 0.5 degrees Celsius to 1 degree Celsius per minute. The other is hyperthermia. Hyperthermia is fever or temperature above 37 degrees Celsius. This is most of the time is a sign of infection, usually in term neonates. In all febrile neonates, a diligent search for a possible infective focus must be made, and hyperthermia may occur due to raised environmental temperature in some cases. So hyperthermia is not always a sign of infection. We should have to make sure that the area is not warm. Environmental temperature might contribute to the increased body temperature of the child. This may be treated by moving the baby into a cool environment and using loose light clothes for the baby. When the temperature is 37 degrees Celsius to 39 degrees Celsius, undressing and exposing the neonate to room temperature is usually all that is necessary. If the temperature is above 39 degrees Celsius, the neonate should be undressed and sponged with tepid water at approximately 35 degrees Celsius until the temperature is below 38 degrees Celsius. Many times in nursery, overheating under warmer is the common cause of increased temperature rather than infection. So do not use cold or ice water for thanks for watching, and don't forget to subscribe for more, and like and comment below.